Welcome to the ParlAmericas podcast. In this episode, Dr. Daniel Buss, Unit Chief of the Climate Change and Health Unit at the Pan-American Health Organization, highlights why climate policy cannot be effective without including public health. In his presentation, Dr. Buss remarks on his experience integrating an equity-oriented health approach into climate discussions and the strategies he has found most effective for highlighting connections between climate, health, and gender equality across global and regional instruments. This episode was recorded during the sessions Voices at the Table, Collaborating for Impact, as part of the virtual meeting Navigating COP Negotiations, a guide for parliamentarians on participation and the oversight of multilateral environmental agreement commitments, held on July 24, 2025, and the lead-up to COP30. Bienvenidas y bienvenidos al podcast de ParlAmericas. En este episodio, el Dr. Daniel Buss, jefe de la Unidad de Cambio Climático y Determinantes Ambientales de la Salud de la Organización Panamericana de la Salud, destaca por qué la política climática no puede ser efectiva sin incluir la salud pública. En su presentación, el Dr. Buss comenta su experiencia integrando un enfoque de salud orientado a la equidad en las discusiones sobre cambio climático, así como las estrategias que ha encontrado más efectivas para visibilizar las conexiones entre clima, salud y igualdad de género en los instrumentos globales y regionales. Este episodio fue grabado durante la sesión Pluralismo de Voces, colaborando para generar impacto, como parte del encuentro virtual Navegando las negociaciones de la COP, una guía parlamentaria sobre la participación y el control político de los compromisos de los acuerdos ambientales multilaterales, realizado el 24 de julio de 2025 en el marco de la preparación hacia la COP30.
And I'm truly honored to be here today, and I thank you very much for the opportunity. But maybe just before I jump in answering the specific question, let me congratulate ParlAmericas for continuing this dialogue in this spirit of multilateralism and collaboration among nations in the Americas. We need there more than ever to have these spaces. It is tremendously important to engage with parliamentarians, and I follow the discussions of this forum with a lot of interest, as is the perfect link between civil society, academia, executive governments that we also work with directly from PAHO, but also the legislative piece. And we can only achieve so much in developing and enforcing legislation in the region if we work with all these forces, all these stakeholders together. And secondly, I want to recognize, before I respond to the specific question as well, but providing a little bit of a background of where we are going with health and climate change in COP30, because there has been some path that we already passed in the last few years that I would like to mention. But also, I would like to mention and commend countries of the Americas for their leadership in climate and environmental health. I think that the ones that preceded me mentioned that Colombia held in November last year the COP16 of the Convention of Biological Diversity. That was in Cali. That was a very important meeting where, for health as well, it was approved a global plan of action on biodiversity and human health, which is particularly important for countries of the Americas, because it speaks about the production of medicine extracted from nature, for example, including medicinal plants that are also a valuable part of knowledge of indigenous and other traditional peoples in the Americas. And also it speaks about the benefit-sharing mechanisms to support that, including financially, where peoples who have previous knowledge of the benefits of using those medicinal plants should also receive a share of the resources that are generated with medications, vaccines, etc. Then also last year, Brazil's presidency of BRICS, there was a climate and health program that was produced. So it's also important to take that into consideration. And in Colombia this year, in March, PAHO, Pan American Health Organization, with the WHO, the World Health Organization, we held the second global conference of air pollution and health in Cartagena de Indias, in Colombia. And it was very important because countries globally, but also countries of the Americas, committed to reducing 50% the health effects associated with air pollution by 2040. And that's a major commitment made by governments and civil society and academia in the region of the Americas and globally, because by improving air quality, we are also tackling the climate-related short-lived climate pollutants, for example, or other constituents of greenhouse gas that a country and a city emit. So by expanding the work of air pollution and climate change, we are able to not only deliver better health and well-being, but also tackle climate change. So specifically about COP processes, I want to raise your attention as well that in COP28, we had the first time ever a dedicated day for health. So after 28 COPs, we had a fully dedicated day for health. This year, we're going to have in November 13, the Health Day during the COP 30 in Belém. So it's a very important day that marks as well these type of discussions for the sector. Back to COP28, we had the UAE Declaration on Climate and Health that was signed by more than 130 countries. And now that if we fast forward to COP30, we're going to have next week, starting on Tuesday in Brazil, the Pan American Health Organization, the World Health Organization, with the government of Brazil, we are organizing the Global Conference on Climate Change and Health. And it's a very important conference for us because we are supporting the Brazilian presidency of COP30 in preparing a document and doing a consultation to prepare a document that is going to be presented by COP30 presidency of Brazil called the Belém Health Action Plan, which outlines actions to be held by the health sector and other sectors, but aiming to produce health indicators to tackle climate-sensitive diseases and conditions, for example, by developing health surveillance and early warning systems. And then so the health sector in general is better prepared to anticipate, prevent, better respond, and quickly recover from climate-related events. I take notes of Caribbean colleagues here, so to work with early warning systems for hurricanes, for example, or climate-sensitive vector-borne diseases such as dengue, malaria, Zika, chikungunya, and the effects of heat that is growing in this region. And I want to call your attention, parliamentarians, about the effects of heat on health and wildfires as well, both in human health, but also in environment. But we always try to work with these sectors to promote health, but also to increase health equity. So responding or getting closer to respond to your question. So the most affected persons are usually not the ones that generate the problem. So also this creates an important situation, a vector of work. So focusing on populations in situation of vulnerability is particularly important. Migrants, people experiencing homelessness, children and the elderly, outdoor workers, for example, for heat effects. This health action plan, what Brazil is proposing for COP30, and I'm happy to circulate the document if you didn't have the chance to have a look at that. This health action plan recognizes the differentiated impacts of climate change to different populations and also proposes a way forward to advance with a just transition process. But also let me remind you of another piece that addresses incessantly with the 35 countries and 18 territories of the Americas that are our constituents. We have a dedicated Caribbean health and climate change action plan. We have a dedicated agenda, regional policies that we have. They all synergize very well with the proposed Belém Health Action Plan, but also the recently approved PAHO's policy on strengthening an equity-oriented health sector action on climate change and health. And in this policy, we have 5 main lines of action, and I'm going to outline one of them that is particularly important to respond to your question. Improving governance on climate and health is one of the pieces, very important. So the health sector is sitting at the table and negotiating, as other colleagues have mentioned, the importance about that, but also having the specific tools to improve health surveillance, linking that with climate change. I mentioned already the early warning systems and response plans, but those must really include strong social participation from civil societies, community, academia. So hearing the voices of the ones that are being affected, really into tailoring specific action plans that are not flying over nations and global, but also going to the territories and having very specialized response plans dedicated to those communities. Also to reduce greenhouse gas emissions from healthcare facilities and from the whole health supply chain, which is massive in many countries, is one of the most expensive or procured ministries that we have in countries. So we can have a massive reduction of greenhouse gas emissions by choosing better suppliers for health services as well. But also addressing adaptation and climate and building climate resilient health systems to better respond to the challenges that climate change can exacerbate. For example, mosquito is changing, right? Aedes aegypti mosquito that can transmit dengue, Zika, chikungunya. It's expanding its distribution. To talk with Canada, for example, Lyme disease is also expanding north as well because of climate change. So we do have data that back up these statements that I'm making, but also it exacerbates the effects of heat, and especially it exacerbates the impacts of existing deficiencies. So the ones that do not have good air quality are usually the ones that are affected by not having water and sanitation services. They don't have access to health services as well properly. And those are the populations, the situation of vulnerability that is going to be affected the most by climate change. So that's very important that we have these plans and interventions that are tailored to these people's needs. And to address that to all peoples. So just one example, we are working with communities all over the Americas to have healthier housing, water, sanitation, and hygiene, green spaces to reduce the heat island effects in cities, for example, and to expand active transportation systems that are safe and healthier for all the people. And we measure all that and can provide to governments and to parliamentarians the tools to measure the health economic avoided costs of health of doing a policy or intervention differently. And then it can be used as a decision-making tool to provide the better interventions and activities that can also promote health and tackle climate change at the same time.
In the second part of his intervention, Dr. Buss highlights strategies for how parliamentarians can ensure that health concerns, particularly those of vulnerable and frontline communities, are integrated into climate action. Let's hear Dr. Buss's response. En la segunda parte de su intervención, el Dr. Buss destaca estrategias para que las y los parlamentarios puedan garantizar que las preocupaciones de salud, en particular las de las comunidades vulnerables y de primera línea, se integren en la acción climática. Escuchemos la respuesta del Dr. Buss.
I'm going to switch to Spanish in the spirit of keeping this dialogue open with all peoples of the Americas. No, le agradezco mucho por la pregunta. Es una pregunta difícil de responder, porque imagino que el trabajo de un parlamentario debe ser brutal, ¿no? De conseguir balancear todas las opiniones y desde el lado ambiental, pero también de todos los lados, ¿no? Y cómo hacer un buen balance. Por primero participar y promover ese tipo de diálogos, ¿no? Yo creo que los parlamentarios pueden recibir informaciones tanto de los expertos como de sus propios constituyentes, ¿no? En el país, los ciudadanos de un país y que también van a expresar cuáles son sus opiniones y sus prioridades. Pero un tema quizás importante es de garantizar que todo lo que sale de discusiones a nivel global también puede reflejarse en legislación nacional, local. Eso garantiza que mismo que si algún acuerdo global tampoco va muy adelante, ustedes tienen a nivel local y nacional, ¿no? Subnacional y nacional, los mecanismos para dar seguimiento a la implementación de algo que sea particularmente relevante para los ciudadanos de esta comunidad, de este municipio, de esta provincia o de este país. Y como regional o mecanismos globales, es importante que ustedes pueden servir también para hacer con que las voces de estas poblaciones, ¿no? De los indígenas, como está en la pregunta, ¿no? De los jóvenes, de las mujeres, que puedan también llegar a esos espacios de negociación que son globales. Muchos no son legalmente vinculantes, pero sí pueden ser legalmente vinculantes a niveles nacionales o subnacionales. Y eso es algo importante porque son los mecanismos. O sea, ustedes tienen uno de los principales mecanismos que pueden hacer con que eso no se quede solo en las conversaciones de la COP, ¿no? En el aire y en estas mesas de negociación, sino que pueda venir al territorio y ser anclada en respuestas reales y diseñadas para cada población que sufre con los efectos, no solo del cambio climático, como yo decía, ¿no? Con las deficiencias que siguen existiendo para el cumplimiento de los objetivos del desarrollo sostenible, que justo ahí donde el cambio climático exacerba los impactos, ¿no? A los que no tienen casas adecuadas, ¿no? Hogares adecuados o no tienen acceso a calidad del agua, esas son las que el cambio climático va a exacerbar los efectos y son las poblaciones más afectadas por huracanes, no tienen acceso a servicios de salud o educación o ingresos. Entonces, o sea, hay que tomar una decisión muy fuerte, en primer lugar, para protección de las poblaciones en situación de vulnerabilidad. Eso puede ser el camino central de garantizar que al hacerlo ya aumenta la resiliencia al cambio climático. Como yo decía, exacerba los efectos de las deficiencias existentes en el sistema. Entonces, trabajar para la protección de estas personas, tomando en consideración, yo les di algunas herramientas, ¿no? Que también desde salud podemos brindar de medir cuáles con la ley o la intervención A, B o C, con esos escenarios, cuáles serían los costos ahorrados por salud con menos hospitalizaciones, menos muertes, menos discapacidad generada por las intervenciones y eso puede servir para la toma de decisión informada para la protección de la salud en primer lugar y tener salud como un indicador de acciones en clima, en infraestructura, en servicios, etcétera, es una medida que todos entienden. Si uno habla de tu salud, uno para y te escucha. Lo vimos lo que pasó con la pandemia, desafortunadamente con un ejemplo malo, pero ahí sí todo el mundo se paró para discutir este tema. Cambio climático es un desafío de igual o, si no, mayor dimensión que la pandemia que tuvimos de COVID y por eso tenemos que tratar con la misma gravedad, con la misma seriedad este tema. Así que cuento mucho de seguir, me autoinvito a seguir conversando con ParlAmericas porque es un espacio fantástico en que podemos, yo estoy leyendo acá el chat, ¿no? cuántas contribuciones, de cuántas personas interesadas en el tema y que están compartiendo sus propias experiencias. A mí me encanta poder aprender y como Organización Panamericana de Salud ayudar a dar escala, construir mecanismos multi o bilaterales para que los ejemplos exitosos, las oportunidades y también los desafíos puedan ser compartidos entre todos en un espacio de conversación y de intercambio para una promoción de mejores indicadores de salud y bien vivir de todos y todas en las Américas. Así que muchas gracias una vez más por la invitación. Encantado de verdad de poder participar de este espacio.